The first muscle we're going to cover today is the trapezius muscle. It's the largest muscle in your back. It's right there. It has 3 main muscle movements. The concentric muscle movement elevates the scapula, and then the lower trapezius adducts the scapula. The eccentric muscle movement, the middle fibers assist rhomboids with scapular abduction. Then your forceful muscle movement counterbalances pull of gravity on the head, as the head tends to be pulled into flexion due to its anterior center of gravity. Then the proper directional movement term is flexion. And then 2 bones are the occipital bone, and then your vertebrae. And then the origin is the occipital bone, the ligamentum nuchae, which is right there, and then your spinous process. The insertion is the lateral third of the clavicle and acromion and scapular spine of the scapula. The next muscle we're going to go over is the sartorius. The sartorius is the longest muscle in the body, and it goes down your leg. The main muscle movement is the concentric muscle movement accelerates hip adduction, flexion, and internal rotation. The eccentric muscle movement decreases hip abduction, extension, and external rotation. Forceful movement at the hip flexes the thigh. The forceful movement at the knee medially rotates. The joint span is over the hip and knee joints. And then the proper directional movement term is the flexor and rotator of hip. The 2 bones are the hip and the tibia, which is down here. Then the origin is the superior anterior iliac spine of the pelvic, which is right there. And insertion is at the pes incernus, medially from the tibial tuberosity. The pes incernus is right there. Next muscle we're going to do is the tensor fascia lata. This muscle is right there. And the main muscle movement is the concentric muscle movement is function of hip flexion and abduction. The eccentric muscle movement is sideline hip adduction. The forceful movement is balance. It helps you when you walk. The joint span is the hip joint and tibia joint. The proper directional movement term is flexion and rotation. And then the 2 bones are the hip and then your tibia. And the origin is the ilium and front portion of the iliac crest, which is right there. And then the insertion is the iliotibial tract, which runs down the side of your leg. Next muscle we're going to cover is the latissimus dorsi. This muscle goes down the back, like that. And the main muscle movement is the concentric muscle movement abducts the shoulders. The eccentric muscle movement adducts the shoulders. The forceful movement rotator of the trunk. The joints are the shoulder joint. And then the proper movement term is extension and transverse extension. The 2 bones are the spine and the humerus. Spine and humerus. And then the origin is the spinous process of vertebrae T7 through L5 and the iliac crest of the sacrum. The insertion is floor of the intertubercular groove of the humerus, which is at the top of your arm. The next muscle we're going to cover is the gastrocnemius. The gastrocnemius runs down the calf, and the main muscle movement is the concentric muscle movement is contraction of the muscle movement. The eccentric is the release of the calf muscle. The forceful movement is plantar flexing the foot at the ankle joint. Joint spans are ankle joint and knee joint. The proper movement term is flexion. The 2 bones are heel and the patella. The origin is the medial epicondyle of the femur, which is right there, and then the lateral epicondyle of the femur, which is right there. The insertion is the calcaneus via the Achilles tendon, and that is right there. The next muscle we're going to cover is the extensor digitorum longus. That muscle runs down the side of your leg, and the main muscle movement is the concentric muscle movement is the extension of toes. The eccentric muscle movement is dorsiflexion of the foot. The forceful movement is a version of foot, and it's what keeps your foot flat on the ground. Joint span is the ankle joint. The proper movement term is extensor. The two bones are tibia and fibula. And the origin is the lateral condyle of the tibia. Lateral condyle of the tibia, right there. And then anterior surface of head of fibula, which is right there. The insertion is middle and distal phalanges of digits 2 through 5, so those toes. The next muscle we're going to cover is the flexor carpi radialis. This muscle is right there, and the main muscle movement is. The concentric muscle movement is the abduction of the hand at the wrist, and then the eccentric is the adduction of the hand at the wrist. The forceful movement is flexion of hand at wrist. It's what keeps your wrist straight. The proper movement term is flexion. The two bones are metacarpals and your humerus. The origin is the medial epicondyle of the humerus, which is right there. And the insertion is base of index fingers, or index finger right there. The next muscle we're going to cover is the rectus femoris. Rectus femoris runs down the middle of your thigh. The main muscle movement is. Concentric muscle movement is extension of the knee. The eccentric is the release of that extension. The forceful movement is flexion of the knee. Joint spans are knee joint and hip joint. The proper movement term is extensor. The two bones are pelvis to just below the knee, pelvis below the knee. Origin is the anterior inferior iliac spine and ilium above the acetabellum. Insertion is quadriceps tendon to base of the patella and onto tibial via patellar ligament. The next muscle we're going to cover is the tibialis anterior. The tibialis anterior runs alongside the shin. The main muscle movement is. The concentric muscle movement is dorsiflexion. The eccentric muscle movement is inversion of the foot. Forceful movement is what gives you balance when you stand on one foot. The joint span is your ankle joint. The proper directional movement term is plantar flexion. Two bones are tibia and ankle. The origin is the upper half and lateral condyle of the tibia, and the insertion is medial cuneiform and first metatarsal bones of the foot. The next muscle we're going to cover is the deltoid. The deltoid is right there. The main muscle movement is. The concentric muscle movement is adduction of the arms, and the eccentric is abduction of the arms. The forceful movement allows you to hold your arms out. The joint span is the shoulder joint. The proper movement term is flexion and extension. The two bones are the collarbone and the shoulder blade. The origin is the lateral third of the clavicle and spine of the scapula, and the insertion is the deltoid tuberosity of humerus. The next muscle we're going to cover is the bicep. Bicep is right there. The main muscle movement is. The concentric muscle movement is the adduction of the bicep. The eccentric is the abduction of the bicep. The forceful movement is what allows you to lift objects. The joint span is the proximal bicep tendons. The proper term is flexion and supinate. The two bones are the radius, ulna, and the clavicle. The origin is short head, coracoid process of the scapula, and the long head is supraglenoid tubercle. The insertion is the radial tuberosity and bicipital epinosis into deep fascia on medial part of the forearm.